So next, let's talk about this word antipyretic. What does this mean? So pyrexia means fever, so antipyretic means anti-fever. So ibuprofen, and indeed all the non-steroidals, are able to bring down body temperature when someone's suffering from a fever. Now, the other major drug that shows antipyretic activity is paracetamol, and indeed paracetamol would be the first line antipyretic, and then you'd go on to using ibuprofen to treat a fever if paracetamol alone isn't able to bring it down into normal level. Now, I talked about paracetamol's activity as an antipyretic in my video on paracetamol, and someone asked an absolutely fantastic question in the comments on that video about why do you want to treat a fever? Surely the fever's there to help the body cope with the infection. Well, let me try and answer that question here. So, firstly, we do treat fevers. In hospitals all over the UK and I think all over the world, the first thing a nurse does when a patient spikes a temperature is they give them paracetamol if it's already prescribed, or they come to the doctor if it's not prescribed and ask for a prescription of paracetamol, and they do that to try and bring the fever down. The question is now, why do you want to treat it? Because isn't the fever helping cope with infection? So the classical teaching was that yes, a fever, the reason the body spikes the temperature is that the higher temperature helps eradicate the infection. However, I think that viewpoint is gradually sort of fizzling out. It's a viewpoint that I think is gradually going out of fashion. And the reality is that usually a temperature isn't that helpful for dealing with the infection and actually tends to destabilize the body rather than help beat the infection. So let me just give a little bit more context to this. So let's say that we've got a young person, a 25-year-old, and let's say they've got a really bad viral infection. Maybe they've got the flu, or maybe we could use a topical example, maybe they've got coronavirus. So they've got a really bad upper respiratory tract infection, let's say. It hasn't got down into the lungs or the lower airways, it's just got to the nose, the throat, and the voice box. So they've got a really sore throat, they've got a hoarse voice, and they're really under the weather, and they're lying in bed, not feeling well at all, and spiking temperatures. So it is a classical thing that happens when you're ill with an infection. The body spikes the temperature, and the classical teaching was the reason it does this is to try and help beat the infection. However, as I say, that viewpoint seems to gradually be fizzling out. And instead, what you have to realize is that the body does a huge number of things when you've got an infection, and not all of them are actually helpful at all. In fact, usually the reason that people die from infections isn't because the infection directly has led to death. It's actually because of the way the body has coped with the infection, that it's so bad that it then leads to the whole body becoming destabilized. This is a really important concept called sepsis. So I'm just going to write down some keywords. So I've typed out some keywords here: cytokines, sepsis, and multi-organ failure. So let me just talk about these. So when a portion of tissue is infected, it releases a whole bunch of signaling mediators, a whole bunch of cries for help, basically. The tissue is angry that it's infected, and it releases loads of signaling molecules, hormones if you like, but they're not called hormones, they're called cytokines, that are going to signal to the rest of the body that this bit of tissue needs help with coping with this infection. And these cytokines do a huge number of things. They go into the blood, they activate the blood vessels locally in that tissue and cause them to release white blood cells and proteins from the blood to help deal with the infection. They also go into the actual blood and then go all over the body and tell other parts of the body to help fight the infection. So for instance, they go to the liver, and the liver starts chucking out more proteins that are going to help battle the infection. So things like the complement proteins, they're really important in beating infections. However, the problem is these cytokines also do bad things as well. Our body isn't perfect, it's not perfectly designed. Instead, it's something that evolved, and it is good enough, but it's not perfect. So these cytokines can cause other organs to start to misfunction. And indeed, if the infection gets worse and worse, then the cytokine production can get so high that it then leads to major problems with the body. This is the concept of sepsis, when certain organ systems start to play up, start to collapse, start to not do their job properly, start to fail because of cytokine storm, is is a nice term that we often use. Cytokine storm, which means too high cytokine levels within the blood due to the infection, that is termed sepsis. So when we describe a patient as septic, or when we say a patient has got sepsis from the infection, it means that the infection is so bad that the cytokine production is so high that it's starting to actually cause body systems to majorly dysfunction. And indeed, if this gets bagged enough, it will lead to multi-organ failure, so multiple organ systems failing to do their job properly. And, you know, if the heart and the lungs stop working properly, eventually it's going to lead to consequences that are really dangerous. Potentially the heart will even stop beating because of the cytokine storm. And of course, that's a cardiac arrest. And if your heart doesn't start beating again very quickly, it's going to lead to death. So understand that the body isn't perfect and its response to infection isn't always ideal, and actually sometimes it's the body's response to infection that leads to the actual death of a person rather than the actual infection itself directly killing the person. So all of that rant or that speech was to try and convince you that just because the body does this in response to infection doesn't mean that it's actually beneficial, and usually actually the spike in temperature leads to a progression towards sepsis and towards multi-organ failure. So loads of the organ systems of your body do not like the rise in body temperature, and are not going to function as well when your body's temperature goes up. So for instance, it's classically known that the heart rate goes up when your body temperature goes up, which isn't necessarily what you want. That's moving towards a destabilized cardiovascular system, which is part of sepsis. You also feel a lot iller when your body has spiked the temperature. You're not going to feel good at all. And again, that's partly moving towards a brain that's not functioning properly. And indeed, if sepsis gets bad enough, you go delirious. The brain, you don't know where you are, you become confused, delirious. It's called septic delirium. So spiking a temperature is sort of moving towards sepsis. It's contributing to sepsis. So bringing that temperature down, it moves you away from sepsis back into a more green zone. So this is the reason that we treat people's fevers. It makes them feel better, and it usually makes their whole body more stable, more normal functioning. It moves them away from sepsis and multi-organ failure. So I hope that's convinced you of why we treat fevers and why antipyretic drugs are therefore very useful in medicine. So the main two antipyretics that we use in medicine are paracetamol and ibuprofen. And paracetamol is the first line one, and then if that doesn't work, then we add on ibuprofen. So it's very, very good at this and very useful part of its role in medicine. So let's move on to the fact that it has anti-inflammatory properties. So what does this mean? So let's use the example of arthritis. So let's say someone has got gout in their big toe, or rather the metatarsal phalangeal joint is usually the main one that gets affected. So if you have never seen this, look at pictures of gout on Google and you'll see what I mean. So it's usually the first metatarsal phalangeal joint that gets affected, and the joint becomes really big, really swollen and red. So that's inflammation that's occurred at that joint. So inflammation makes things swollen, it makes things red, it makes things hot, and it makes things painful. I've already discussed that paracetamol is good at getting rid of the pain, but it also is good at getting rid of those other parts of inflammation. It's good at making things less red and less swollen, so it will have some effect at reducing how big, red and angry that joint looks. And it's not just arthritis that it can have this anti-inflammatory property of. If we go back to our example of the young man with a bad upper respiratory tract infection, flu, let's say, then anti-inflammatory properties there will reduce the inflammation of the mucosa. It will reduce mucus production. And how is that going to help him? Well, let's say if he's got a blocked nose from this infection, then the anti-inflammatory properties of taking ibuprofen will help to unblock his nose. It will help to reduce the inflammation of the mucosa. So the mucosa, the epithelial lining will, it might be quite swollen and encroaching in on the nasal cavity. Taking this drug will help to reduce that swelling, and it will open back up the airway, and also the reduction in mucus production. The mucus is probably blocking up what's left of the nasal cavity. So again, helping to reduce that mucus production will help open it up. So getting rid of inflammation from sites where it's occurring will help that tissue to function more normally. So if it's a joint, it will help that joint move more normally. If we're talking about the lungs, it will help the lungs function better. So if someone's got pneumonia, for instance, if you give them an anti-inflammatory, it will help to make the lungs actually work better, because all of the inflammation is contributing to that tissue not doing its job properly. In fact, that's one of the final pillars of inflammation. There are 5 pillars of inflammation that I'll just write down for you. So here we go. These used to be in Latin, and indeed I learnt them in Latin. So pain, dolor; swelling, tumor in Latin; redness, rubor; hot, calor; loss of function, functio lesi. Those were the 5 pillars of inflammation. So even, long ago, people had come up with these 5 pillars of inflammation, so long ago that they'd written them in Latin. So getting rid of inflammation from a tissue is going to help that function is going to help that tissue return to normal function better.